Welcome, Dr. Sue. How are you?
I'm really well. Thank you very much.
Thank you for your time today, and it's a conversation I would love to have and understand your story and backdrop before we get into delve into the idea of politics and public policy from that space. Could you briefly uh, give us your background and your story?
Yeah, so I grew up in Melbourne and I'm the youngest of four kids, and I went to University of Melbourne to do my medical degree, and then I was doing some training in general surgery and decided to go overseas for a little bit, and then came back to regional Victoria and got into the urology program. So I then got transferred across to Perth. That's how I ended up in Perth. It's a national-based training program, and I came across to Perth quite some time ago now, and was fortunate enough at that point that the Nullarbor closed, apparently, and I couldn't go back. Joking. But the job that I wanted to go back to fell through, and the job that I started came up down in Bunbury. And my husband and I looked at each other and said, okay, let's see how we go. So we moved down to Bunbury, and I was the first urologist to set up a practice outside of metropolitan Perth. And I had a sole practice down in Bunbury at the new health campus that they were building at the time. I was heavily pregnant with my first child, and decided that setting up a medical practice and starting a whole new career would be a good time to do all of that at the same time. And then gradually over 25 years have been able to establish a really strong urology practice. By the time I was finishing up, we had 3 surgeons working there. We had a training urologist come down and work with us through the national program, which was really exciting to have a young urologist in the practice, and that had been going for about 10 years.